often we encourage physicians to take, like you said, to take part in committees, to take part in project work and stuff like that. I think the other piece that we need to focus on is somewhat of that organizational development, succession planning, and those different aspects, because there's a change of perspective that comes from moving from
Mm-hmm.
clinical to leadership that is not always a smooth transition, right? And I think
Mm-hmm.
what we've started doing is I have about 6 physician coaches that I've got partnerships with, and we align them with new leaders when we hire somebody. So if a hospital comes to me and says we need a chief of emerge, then if we even experienced candidates, but also less experienced candidate physicians, will partner them for 12 weeks with
Mm-hmm.
with a coach, and I include that as part of my recruitment fee because I believe that the value of the placement is beyond just getting the person to start, but it's getting them engaged and getting them, and focusing on retention and stuff like that, right? So, um, what are the types of big things that you do to support your leaders and support the retention?
Yeah, I think that is actually, love your idea about kind of the targeted coach really assigned to someone in that transition moment. And that is actually, I literally earlier this week was discussing a really high potential individual within our organization. And that is exactly what were talking about. And actually, the leader and I were looking outside of our clinical spectrum as well and saying who from kind of the general management team might be able to like very uniquely enable that
Yeah,
person's growth and kind of push them. And so I think one thing is thinking beyond just the clinical team,
yeah,
especially as you're developing physicians, because often part of the reason they are rising into those early ranks of leadership is because they are a trusted, authentic clinical voice.
yeah,
Where they need to grow and they need that coaching and mentorship is actually outside of the clinical realm. And how do you build their almost their pit crew of
yeah,
people and mentors that they can go to say, hey, like outside of their chain of command, can you help me like understand what's going on here, or how do I figure this out, or who's the right person organizationally? So that is one thing that we do really intentionally. Another thing that I have thought about like within and that we have live within our team is how do we create um, really like peer groups
hmm,
and enable kind of those earlier managers to have a safe space to be connecting and learning from and with each other in
yeah,
a way that their boss isn't in the room, and it's an opportunity to talk about, hey, performance management is really hard. Like, how do you have these really difficult conversations,
yeah,
or how are you talking about this tension between efficiency and making sure that clinicians are delivering high quality care? How are you bringing that to your frontline staff? And
yeah,
so creating the right forums for individuals to be able to learn from each other, and also kind of be vulnerable,
yeah.
is another thing that we have put into place and really seen a ton of value in
Yeah.
doing that over the last probably 18 months.